health-related matters. Today is Tuesday, February 10th, 2026, and driving you through this edition of the program, my name is Angeline Noah. Well, however way you are joining us this morning, wherever you are joining us from, I'd like to say welcome. It's always good to be here with you. For those of you following through the ministry's official Facebook page, I'd like to encourage you this morning to like and share the live stream, inviting others to watch along with you also. Well, this morning we have invited in studio the multi-sectoral committee on drug treatment to give us an update on the multi-sectoral committee drug treatment program that is currently ongoing. And we have in studio with us this morning Dr. Moses Zia II, Director of Mental Health Unit at the Ministry of Health. He's here along with Dr. Azeta S. Sherif, Medical Coordinator at LRRC Holding Facility. Well, we are to take a very short break to be right back. We will continue and take the break later. So let's join our guests right away this morning. Good morning, Dr. Zia and Dr. Sherry. Good morning.
Good morning.
Good morning, Angel.
Let's begin with you, Dr. Zia. How are you doing? How is work going so far?
Well, we're managing by the grace of God. Everything is fine. We are hopeful that everything keeps being fine.
Okay. Dr. Sherry, good morning.
Good morning, Angel.
It's good to have you here. It's your first time. Tell us a little about yourself.
Okay, thank you. I'm Dr. Azeta Sherif, a psychiatrist and medical coordinator of the LRRC Center.
Okay. Hope everything is going well at the center.
We are doing our best.
Okay, I think we will hear more from you as we go into the discussion. Well, we are here this morning to talk about the multi-sectoral committee drug treatment program that is currently ongoing. But firstly, let's get an overview of the treatment program.
Okay, thank you, Ms. Noir. So the Multi-Sectoral Committee on Drug and Substance Abuse, as the name implies, is made of multiple agencies, ministries, agencies, and commission of government, also including civil society organizations, development partners, NGO, and so forth. So the issue about drug is cross-cutting, and so you require a lot of other people to, together tackle it. So this committee, since it was set up by the president, as we are aware, has been working on different aspects of the fight against drug abuse. So we have been fighting to reduce the supply of drugs in our country, and that is the side that the Liberia Drug Enforcement Agency and the security sector generally are responsible for. So they've been going after traffickers, dealers, and so forth. Then there's the other side that has to do with reduction of demand, which is drug demand reduction. That is the side that has to do with doing a lot with people who are potential users or people who are using. So for those who are potential users, the goal is to discourage using these drugs. So we educate them so that they understand the danger associated with drug use so that they don't get to try it. Then we have those who are already using and they are addicted, a number of them are addicted. Those ones we try to treat. So on that side of the intervention, the treatment program has been doing well so far. We started providing treatment in an overall coordinated fashion. So we have people who are private providers. They have their own rehabilitation centers. We are able to work with them so that we improve the quality of rehabilitation work they're doing, the quality of the treatment. But also the government as an entity itself has been able to initiate through the Ministry of Health, with partnership from other organizations, have been able to initiate treatment for the government itself. So as we speak, we have one outpatient center. An outpatient center is like a clinic where you walk in, your problems, get evaluated, and then treatment is designed. We have one of such facility in Concord Town, and we are partnering with one organization called the Mother of Light Rehabilitation Program. It's right in Concord Town. So we have that outpatient center. Then we have another outpatient center in Buchanan, close to the county health team office in Buchanan. So there's another outpatient center. Then in terms of inpatient center, meaning where people go to stay, more like a residential setting, where people stay and receive treatment, we have one in Buchanan, is in a place called Germantown. That one is also being operated in partnership with the Mother of Light Rehabilitation Program. And then now we have the LRRC facility, which started off actually as a holding center, but it has over the time become much more than just a holding center. We're doing full rehabilitation work there as we speak. So that is just a scope of where we are in terms of treatment.
Okay, that's good. Yeah, I mean, you guys are doing well in that direction from what you just explained. It means that a lot is being done by the Ministry of Health, the multisectoral committee, right?
Absolutely.
Okay, you mentioned the reduction of drug demand. How is that process going so far? Let's talk about that before going to.
Yes, so drug demand reduction is a whole pillar. It has to do with how can we prevent young people from initiating drug use, and how can we treat those who already have drug problem. That's generally how to look at it. So on the side of prevention, we're doing a number of interventions. We're doing a lot of awareness and education. All right. We are also integrating drug information in our national school curriculum. We developed a manual that has information on drug use prevention and mental health, and we're incorporating that in the national school curriculum, and the Ministry of Education is leading that process. We also have made a lot of social behavioral change messages that we are able to put on the radio and educate people about the danger of drug abuse. More than that, we've been able to do actual community mobilization, community engagement to educate people about drug use and the risks associated. And so these are all measures intended to prevent people from initiating. Then those who have already started using, we trying to do early treatment for those who started, and they are not going so far inside, trying to get them out. And then those who have been in the street, abandoned for a long time, those are the ones who are typically benefiting the inpatient or residential program.
Okay, so let's talk about progress made so far. Let's highlight progress made so far.
Yeah, so many of what we've listed certainly are some of the progress we've made. All right, so one of the cardinal things I would like to flag is that this committee has been able to develop a national anti-drug action plan, and I think that will be the milestone for the committee as we speak, because when you have a crisis to deal with, the truth is you actually need a strategic plan or a clear roadmap that will bring all the ideas together about how you want to tackle it. So in December of last year, as I remember, it was December 18, 2025, the Multi-Sectoral Steering Committee on Drug and Substance Abuse, under the leadership of the Honorable Minister of Health, Dr. Louis Nkoto, officially launched a 5-year anti-drug action plan, spanning from 2025 to 2030. This plan, I believe, is the major accomplishment of the committee because it lays out clearly the roadmap as to how we are going to tackle drug, and it highlights the roles and responsibilities of all the government ministries, agencies, and commissions that are relevant to the fight, as well as civil society, development partners, and also even the community. So on top of this launch of the anti-drug action plan, we've been doing a lot of prevention work. Like I said, we've been doing treatment for people, like I said, and so I think it's all coming together. And now as we speak, we are now in the process of doing the implementation plan for 2026 from the action plan.
So, Dr. Sharif, you are the medical coordinator at LRRC. It's a good thing that you are here also. So, let's talk a little about LRRC. give us, begin with a little bit of background of LRRC, maybe the establishment, what led to its establishment. Give us a background about LRRC.
Thank you for this question. The LRRC Center, located in Johnsonville, it was established in a background of an emergency situation when the LDA started raiding the ghettos in an effort to destabilize, the suppliers. So it was on August 21st of last year, 2025, that the first batch, gathered after the raiding. They had nowhere to go, and then eventually it led to the Ministry of Youth and Sports, where the alarm, was raised, and government mobilized immediately, and by the end of the day, they were transported to the LRRC holding center in Johnsonville, with the plan, that they were going to keep them and then find subsequently what to do for them, considering the fact that they asked that they needed help for rehabilitation. So that was the conception. So a lot of them, I think over almost 200 of them, gathered over there, and we received them, all of them, by that time, because they are in severe substance use, the fact that they were in the street, they needed to be in an inpatient facility, that is, in a community where they can be taken care of.
About 200 disadvantaged youth.
Over 200.
Over 200.
Mm-hmm.
Okay. So they went there by themselves?
They were taken there by the government.
Okay.
Through the Ministry of Youth and Sports. Yeah.
Okay.
And other agencies. Yeah.
Okay, let's talk about the structure of LRRC. What does the structure look like?
Okay, so basically LRRC, first of all, we have multi-sectoral agencies represented there, led by the health team. So the health ministry is there, the LRRC administration have people on ground, Ministry of Youth and Sports, have representatives, Ministry of Gender and Development, have people, social workers, there, and basically.
Okay.
So we work as a team, and we are running the center.
Yes, so like she said, the intervention, our intervention everywhere we work is multi-sectoral. So the relevant agencies are always represented in our work. Though we are a single team, not as if we are working in fragments. We are a single team, but there are different composition. There's different composition of the team. So the Ministry of Gender, Children and Social Protection has a cardinal role as it relates to linking families to those who are seeking treatment, so that they can initiate the process of reintegration at the beginning of the intervention. We also have the Ministry of Youth and Sports that has a principal role of TVEC, Technical Vocational Education and Training. So those vocational skills, some of them are provided by them, but they also help us on the side of recreation, because these are young people. So, what sporting activities are there to keep them engaged and other things. So Youth and Sport leads that. The Ministry of Health is actually the one who is leading the entire process. Now, when people are in rehab, what they're really there for has to do with rehabilitation. It actually is focused on psychological interventions. All right. So the issue about the particular counseling, the issue about helping them overcome their difficulties, how to deal with problems, how to deal with the triggers, how to deal with the craving, all of those things, are really provided by professionals from the Ministry of Health, including psychologists, psychiatrists, among others. So the team together provides that holistic care.
Okay. Let's talk about the different services being provided at LRRC for disadvantaged youth.
Okay. As part of the rehabilitation process, and especially in substance use disorders treatment, it requires a holistic approach to management.
Okay.
So we have medical services. For example, during the detox phase, which is the first phase when they come, they're having their withdrawal symptoms, the discomfort. So we have to provide supportive care and medication within maybe 2 to 3 weeks. Then after that, once they stabilize, then we get into the rehabilitation process. So we continue medical, services, because wherever you have people, they have to come to the clinic or something. So we run clinic every day. We have the psychological component of it, where we have psychotherapy with them. We have various kind of sessions, anger management sessions, guiding, trying to change the mindset, in order to adapt, more positive way of thinking, which will then have impact on the behavior change. We have occupational therapy, for example. Occupational therapy, on the social side, you may say, vocational technical activities, but it encompasses activities that they can learn with their hands, so that when they should have left the facility, they will be able to fend for themselves. So things like agriculture, carpentry, catering services, just basic things, decoration. So when you go there, you will see the tremendous change, from where we started. Yeah. So we also have recreational activities as well, because in every setting, you need to tend to the social side aspect of the person. So we have various social activities. They play games, they play tournaments sometimes, and they get a win in all of them. Yeah. So basically, these are the breakdown of the services that are being provided there. Yeah.
So you thought one of the services you outlined is medical. The first was medical. How long does the medical treatment go for before you can say this person is okay now, we can do this? We can reintegrate them, then they have to move to the occupational aspect of it.
Okay, so we do them simultaneously. We don't do one before the other. The only one that is done before the others is the detoxification. Now, once they are stable, all the activities are structured in a daily scheduled activities, from wake up time to bedtime. So in between, you have time to wake up, time for morning meetings, where they can discuss activities in the community, what they can learn from, what they can discourage, among themselves. Then we get into each of these activities that are listed. Then if you are sick, you go to the clinic. If you're not sick, you go on, to do your community work, for example. Then you have lunch, your breakfast is already done. Then you have, after your activity, then you have lunch, for example. And then after lunch, then the different psychological sessions, And then after that, we have time for sporting and recreation. And then in the evening hours, if you need medication, you go back for the medication. So they are just intertwined. Yeah.
Wow. I mean, you're doing well for them, though. Do they have to pay anything for the service being provided? How is it like?
No, the services are free, because this is government's own initiative.
Okay.
Yes, government's own initiative. So the government is the chief sponsor of this program. When you hear multi-sectoral, that is because the responsibilities to some extent are shared, by the various entities. Yeah, but it is free of charge.
And also, I'd just like to insert that from time to time, we have other people who go there with donations. So, for example, the One UN is a partner on the multi-sectoral committee. So from time to time, they make donations. There have been instances where the UNFPA has gone with donations, basic things that people use, toiletries, or wearing and other things. They've also been able to purchase mattresses, some mattresses, and taking them. More recently, they were able to help us procure bunk beds. So when we talk about a bunk bed, it's the 2-in-1 bed, single bed, but 2-in-1. And it's very important because when we got to the place, it had been an abandoned facility belonging to the Triple RC. So a lot of infrastructure work needed to be done around, including even setting up, sleeping areas and all of that. So I think a few weeks ago, a week or two ago, the UNFPA rather was able to do the official turnover, although they have reduced some beds. So when you see now, it looks way better. So these are donations that we receive from time to time. Ministry of Education, the other day not LRRC, but LPRC went there the other time trying to donate, and they gave some things. So from time to time, private citizens, NGOs, they go there and give little donations.
So looking at the people you are dealing with, people that use substance, abuse substance, and then started having impact on them. Sometimes they come down with different problems, like you mentioned. So I believe that it comes with a little bit of challenges when you are dealing with these kind of people. So tell us some of the challenges you have to deal with taking care of people who are being affected by drug.
Okay. Yeah, definitely the challenges are there. And in as much as we believe we are making progress, because it is quite visible, the challenges kind of cut across the background of where they come from. Okay. And so adapting to these new activities, this new way of life, it comes with some form of resistance. Okay. And as professionals, we have to take it easy, but at some point we have to be assertive. Okay. Yeah. Now, we have rules and regulations in the community. Okay. Maybe I'll just list the major rules, that is the principles that governs the center. For example, we have no drug use and no possession of drugs, no violence and no threat of violence, no sex or sexual behaviors, no theft or stealing, and no leaving the fence and no absenteeism, whether from the fence or from the activities within the fence.
Okay.
Yeah, no weapons. Okay, so these are the major rules. So now, anybody violating these rules, they have been counseled, they have been talked to, they understand the severity of these rules. Okay, so having been in a facility for quite a long time, up to 5 months, and you are found in such a behavior, that means you are not making progress at all. And at some point, this behavior become a threat to the safety of the environment and even to the progress of the program. Okay, leaving the facility, jumping over the fence. Okay, these are challenges we are facing. Initially, the fence were very porous, very low. You can just jump over it with 1 foot, and there were so many places where the fence was not even connecting, so you can't call that fence.
So they usually do that, jump over the fence.
It has been more like a hidden, they say plain secret, right?
Okay.
So that has been happening, but then as the fence go up, you expect that people will adjust. Now people are deliberately not adjusting, because at this point we can't say that the drug making it to make those decisions, okay, anymore, because they have been there for a while. Now we have people, being threats to the surrounding communities. For example, entering people's houses to steal from them. Those are criminal behaviors. Okay. Now, is that behavior consistent with what we can tolerate within the center? No. Okay. So you go setting roadblocks, for example, for people who enter in the community in the cars, and then you try to harass them for money and stuff like that. Those are criminal behaviors. Okay. Getting out of the community, coming back intoxicated, very drunk with alcohol, or whatever, smoking and stuff like that, is totally against the community rules, the sanity of the program. Okay. Now, why do we take this seriously? We take them seriously because if they continue, then you don't have a program. Yeah. So these are major challenges we are faced with, and at some point, a treatment facility should actually have strict rules. Okay. The reason why it has been, like kind of lenient with it, because everything was not set in place from the very beginning. But now that they are taking shape, everybody has to adjust themselves. Yeah.
Okay, so Dr. Zay, you have to say something.
Yes. I think that's an important question. So challenges are always around. Wherever you want to make progress, you expect that there might be issues to undermine. So our challenges gradually we are still addressing some of them. One of the first challenges we encountered was the issue about inadequate infrastructure. So like I said, when we got in the facility, it was an abandoned facility. The fence was not complete. In fact, it was low fence with wire mesh. At some point, some areas that were cut down, all of that. The septic tank, for example, wasn't okay. So when we got that number of people going there in less than no time, by the time people take bath and use the latrine, you had spills, we would initiate the process of the Liberia Water and Sewer Corporation coming from time to empty the tank. But these were all challenges that were really serious. I also talk about the beds. There were no beds, so we got mattresses. Ministry of Health and other people got mattresses, and they had the mattresses on the floor. It didn't look humane, it didn't look humane like we would want it. So those were the initial challenges we incurred. But with the leadership of our bosses, the strong leadership, we have been able to gradually improve. So the fence issue is being sorted. We are almost done with the fence. In terms of the wall, they've been raised, but we are supposed to put razor wire to prevent intrusion. So that is something that will be happening. The Ministry of Youth and Sports led the construction process of the fence. They also did the septic tank, so we got those ones. Like I said, we got mattresses, we got new mattresses. There were old mattresses, but we got new mattresses as Ministry of Health. And now we're able to advocate with our partners. We got the bunk beds looking decent now compared to what it was before. And then the issue about food. Initially, we had challenges, because when the guys suddenly came together and went to the facility, we didn't have anywhere that we expected to, just run and take food. And with government processes, government procurement, it takes some time. So I know the Honorable Minister had to practically pool resources, just calling people to bring this. When she called Commerce Ministry, bring some rice, bring this, just to start off, right? But as we went ahead, clearly we had to adjust so that the procurement process could happen. Again, you're trying to help, but if you don't do it right, the issue about audit comes up, how you got these things, how you feeding the people. Now you're trying to do good, right? But then it turns around. So because of this, some of the natural procedural processes and bureaucracies would delay sometimes the process of getting things adequately. But the good thing about it is we have a leadership, the Honorable Minister, who is very instrumental, very, very influential. So we've been able to pull things here and there to keep the facility functional at all times. Now we are a lot more stable. We're able to procure things that are serving, the facility. And with the donations that come from time to time, they give us a little buffer. So now, in terms of feeding, we're okay at the facility. In terms of basic needs, we are okay, But then I just want to go back to these challenges that Dr. Sharif mentioned. And I know recently there were concerns that, why are there people leaving the fence, and then they want to come back, then we say they shouldn't come back.
Okay, yes.
I think that is one of the challenges that I would like to emphasize. So she said it rightly so, that you have a treatment center. The treatment center is built on the model we call therapeutic community. A community is a group of people dwelling together, right? So people in that facility, both the beneficiaries, meaning people who are seeking care, and those who are providing the care, together they are dwelling for the same goal. And in this case, the goal is to help these people overcome the drug problem, right? So clearly there are rules and regulations. People who are suffering from drug use disorders, and especially so had been having severe substance use disorder for a long time, they do not know anything we call rules.
Exactly.
They're not aware of social norms. They are not aware of routines.
Exactly.
They do what they want to do at what time they want to do it. So that is the cardinal thing we work to change in the treatment program. So what time they wake up, what time they do this, what time they do this, what rules they should obey. Obviously there will be challenges. But we are aware, as professionals, that's our field. We know, behavioral science. We know that this is how you work with these people. But while working with them, you encourage them to do well, but the concept of what we call social learning, you may have heard something called social learning theory, where you have reward and punishment. If there's a behavior you're trying to encourage, you give reward. And there are ways you give rewards. We have technical terms we can use. But the goal is you reward a behavior that is good so that they can repeat it. But you punish a behavior that is bad so that people can desist.
Exactly.
So using these concepts, they are cardinal to the treatment program. They are cardinal to the rehabilitation process. So there are some rules that are absolute rules. Those ones, when you offend and you are educated enough to know that those are cardinal rules, and when you offend, this is the outcome. This is the punishment. For example, if you leave the facility, you are not supposed to come back until later when we're trying to do another recruitment process. Why? And I will tell you in a bit. But that's one of the cardinal rules. If you come here to stay here, first of all, you sign informed consent that you are there voluntarily. And when you're ready to leave, you are at liberty. Just inform the team so that they can work with you to process you out of the facility. Why we let you inform the team? Because maybe you might be angry about something. You say, oh, I'm leaving. So when we say let the team know, the team is skilled enough to investigate what is driving you to want to leave. And then when we investigate that, we're able to counsel you and persuade you otherwise to stay, right? It is part of the process. So we ask you to do that. But if you are jumping over the fence, it means that you do not want to be there. And when you jump over the fence, why do you want to come back? Now, wanting to come back is not our problem. But when you come back, the problem is that two things. One, you encourage other people to leave when they want to and come back when they want to. Then you're not running a treatment center. Secondly, when they go out, what do you think is the reason they go out?
Exactly. Sometimes they want to still chase the same habit.
They're going right back to use the drug and come back. But when they come back, do you know what troubles they're coming back with? In order to go out and use the drug, they need resources. So that time that they are leaving the facility to step out, many of them engage in the criminal behaviors. They steal from people, they do this, they do that. When they finish stealing, they go and use the drug. Then they run back into the facility. What do you think? So that, we are harboring people who are committing crimes. So if the police was to come after him now, they will come in the center and say, oh, you're harboring criminals, right?
Yes.
So those rules are strict because we don't want you to go out and cause problems. But also, when they come back, remember they have gone to use the substance. When they come back, the natural thing that will happen is that they will be dealing with the withdrawal symptoms. What you dealing with withdrawal symptoms is commonly irritability. They are easily annoyed. Aggression, verbal and physical. And then they can become violent. So when you have those people going out and coming in and they are in that state, what do you think will happen to the community? Chaos can ensue. And people get injured. We've had instances. People get injured. People broke their arms because they are fighting among themselves. So because of these things, we have those cardinal rules. You talk about some of the other rules. But I just thought to emphasize that rule that when you are here voluntarily. When you want to leave, let the management team know they will process you to leave. But if you leave unceremoniously, it means that you don't want to be here. So you are not welcome at this moment because you are going to destabilize our community. And we have had instances when the fence was still low, they will sneak out and come, they sneak out and come. Every day you got crisis in the facility. And once one or two person goes and comes back, one of the dangers is that they bring substances with them when they're getting back in the facility. You know them. They will bring substances. When they bring substances, they go in a part of the compound and they are smoking. Remember the other guys who are staying there, they're still struggling with their addiction. They are not really okay yet, right? They have not really overcome their triggers or their cravings yet. So by the moment you come with that substance and you start smoking in a part of the facility, you trigger everybody else. next thing, everybody wants to go out or they want to come and smoke with you. Then you create chaos. So for these reasons, we made it very strict. And now with our fans being, oh, we are better now, to say if you go out, just know that you're not coming. And the good thing is, we put the community doctrine in them, the beneficiaries themselves. We have leadership. We have units, meaning a number of people constitute a unit. We have a team leader. So we have those leadership structures to govern the place. Like I said, it's a community, it's not a hospital, it's a community. People are dwelling there. So we have structures. And part of the role is to educate them about responsibility, taking responsibility, being a leader and all of that. So when people escape and come back, it is the leaders themselves among them who will highlight those and make a list and bring it to management and say, these number of people jump over the fence. Why do you think they do that? Because they know that it's a responsibility of the community to keep the community safe. So when they bring that list, imagine you the partner. Or some of the children offended, then the other people brought their complaint. And then you look at it and say, okay, it's okay, let me leave it. What do you think happening next? All the other people will start doing it, right? So as a way of ensuring that we are encouraging good behavior but discouraging good behavior, we take the measures. Some of the offenses, when they do, it requires counseling. It requires continuous, advice. But some of them are absolute. And when you do it, we ask you out of the facility. So there's been a number of them hanging around the facility because they are used to going and coming. They hang around the facilities that they want to get back in. We say, no, at this point in time, you can't. So that's one thing I just thought to make real emphasis on.
Yeah, Dr. Sherry?
Yeah, so just to add a little more to what he said, thank you, Dr. Zia. It's important to know that there's a huge percentage of these people that come in a facility who self-discharge, that is, they leave and they never come back by themselves. And it's far greater than the number, that we would take action on because of continuous or persistent negative behaviors. So it doesn't appear like the number of people who have come to that facility before and are not there now, they were put out. Okay. That concept of putting them out, I think we need to look at it in a different view.
So how many do we have in rehab currently?
Currently we have around almost 170, around 170, 168, 170 in the rehab center currently.
Okay. So while you were talking previously, this question came to me. I'm concerned about the mechanism you have in place, to monitor different things being donated at the facility for the use of disadvantaged youth.
Oh, okay, great. So the first thing is, whenever we get, let me start with the donations. Whenever we get donated items, it's done publicly in front of the staff and beneficiaries. The things are checked right there. The beneficiaries, they themselves are involved in checking the items with the leadership. We don't stop them. Okay, in fact we encourage them. We feel like that's taking initiative also. Okay. So they get the account. We have our account. We look at it and see, if it's in line, with each other, and then they help to transport the items to the warehouse where it will be received by the warehouse team. So in that way, right outside in front of everybody, the staff know, the beneficiaries know what came in and what gets into the warehouse. Now, when it goes to the warehouse, it leaves from there by request. Okay, it leaves from there by request. For example, if the IPC person, wants, if they need to wash their laundry, we have to give everybody soap to wash for that week. Okay, so they wash on the weekends, Saturdays. The IPC person will go and sign for the number of soap and distribute it on them for them to wash the next day in the morning, for example. Food items, the kitchens are based on what we cook for that day. They are going to, the list is going to be made, and then it's going to be approved, and then the warehouse will disperse those items to the kitchen. Okay, and even items that reusable items, for example, they are there and it is supervised by someone from the warehouse, and also some of the staff that are working along with them. For example, if they're going to work in the garden, or the hoe, or cleaning the yard, those materials, they are supervised by the staff, and in collaboration with the beneficiaries, they have to return those things, for example. The same with the food stuff received from the Ministry of Health. Okay, we'll make requests, the delivery is done, and the items are recorded, and we follow same procedures in tracking the items. So that this is Liberia. Sometimes people may have different ideas, but I believe once they understand how things are going, then it helps to give clarity.
Yes, and quickly, we have a very robust accountability system.
Okay.
I will show you that. So things that are purchased through the Ministry of Health, we have the system to ensure the delivery and the utilization. So report is generated from time to time, including things that are donated. So the team there makes report from time to time, and from time to time we counter check. There are people from the central office, Ministry of Health, from the warehouse department that goes there to train them how to proceed, running the warehouse and all of that. And again, like she was saying, sometimes people just, like people can make outrageous accusations without any meaning. And I've heard people say, oh, they're eating the food that the beneficiaries, they think people donating, people eating. Come on. If I tell you how much money Dr. Sherry, myself, and some of the people who go there use out of our pocket from time to time, because there are challenges on the ground and procurement process will not permit, that thing to be handled in time. So we spend out of our pocket all the time to ensure things are going on. But then people will just say all the things they want to say. But I can assure you, accountability is key in terms of what we do there.
Okay, accountability is key, and you guys are doing a great job there. I must appreciate your effort. We will have the phone lines open now to have our listeners participate on this program. If you just join us, you're listening to Roadway to Health, an hour-long program brought to you by the Ministry of Health. We're in talks this morning with Dr. Sherif and Dr. Zia, and talking more on the multi-sectoral community drug treatment program. To be a part of this discussion this morning, you can call us on 0775 677 376, 0775 677 376, 0880-514-096, 0880-514-096 are the numbers to call. Well, I think we have our first caller. Let's take this person. Good morning.
Good morning.
Can you walk away from your monitor?
Hello.
Good morning. Your name and where do you join us from?
Good morning. My name is Carmen Mo, and I joined you from my Kingsley resident.
Yes,
let me say good morning to your studio guest.
You need to walk away from your monitor. We will not continue with you if you.
Okay, sorry. I see it's better now. You're having school to Lunati. Hello.
Yes. Go ahead.
Firstly, let me acknowledge with thanks and gratitude to His Excellency President Joseph Boaga and his international partners for affording these disadvantaged youth the opportunity to go through the rehabilitation and reintegration process. Now, this is my point, and I go straight to the point. The first thing you guys fail to realize that no one went out looking for them. They came willingly to the Ministry of Youth and Sports to go through the program. And they should take into consideration that center at the El Triple RC Holding Center is a treatment center. And I give you a practical example. Nowhere, you and I know that, for example, if you go to the hospital and you are admitted as a patient, you know you will not be discharged except with the consent of the doctor who is treating you. This is the same thing that should happen there. That place is a treatment center. Wherever you guys then go at the treatment center, they should know that there is no way that they should go out and there's no way that they should come in. They should be there until they can be discharged by the rightful authorities. So they should take into consideration this is a privilege that the government of Liberia is affording them. Thank you very much for affording me the opportunity.
All right, thank you. 088051409 let's take this person. Good morning.
Good morning.
Your name and where do you join us from?
I'm Terry Joseph Sucker. I call you from Congo Town.
Let's hear you quickly.
Yes, I want to say thank you for the program and also thank so kindly to your guest, Dr. Zia and Dr. Sharif.
Okay.
I want to speak specifically to those who run social media programs, the bloggers and the other people who usually come up with information that seem not accurate. Yes, I just want them to know that what is going on at the LRRC Center here is completely science-based. It is not just being run by any people, but it is being run by psychiatrists, addiction professionals, psychologists, and the likes. So, again, another thing is making conclusion of the information they got from a single site. For example, there has been some video circulating about ill treatment of the beneficiaries at the LRRC Center. And you will find out that conclusion is just made because somebody who left the facility was denied access back in, and then people will, their conclusion and say all kinds of things, tarnishing the people who are offering, the reputation of those who are offering service to the place there. And again, I just want to also add that it is also okay that this thing be free of politics, because I can recall quite recently these same people who were allowed out, there were other people who advocated for them to come in. And the team, being so generous, decided to allow them in, but they got to be tested first. If they are negative of the substances, they will be allowed. And all of them said they were negative, they were not taking any substance. And you will be surprised that these people who have said all kinds of things that they are not taking any substance, they want to go out for other things, were positive of the very substances that they said they were not taking. So this is just my little contribution, and I just want the public to understand that if an information comes from a single source, let it be balanced. Try to ask why these people were put out. What did they do? What are the rules and regulations that govern the center as compared to just considering one party to be bad? Thank you very much.
All right, thank you. Let's take this person. Good morning. Okay, I think we lost that. Dr. Zia?
Yes.
We can just respond to the few concerns,
Well, I just want to thank the callers for contributing to the conversation. Some of them are aware of the work we do, and so they are giving their contribution. So the last caller that mentioned the issue about bloggers, I think this is really important. And, it really breaks my heart to see people who are sacrificing and doing so much, get accused falsely, and then other people, without even verifying the information, running on with the news and trying to tarnish their reputations. There are high-level professionals who run that facility, and we are very proud of them. Liberia, over the time, has produced a number of high-level mental health professionals. Dr. Sharif is one of them. She's a seasoned psychiatrist and also an addiction professional on the side of treatment. We have a lot of people that the other lady called Mrs. Sion answer to. Those were names that some of the guys were running on social media with, that all the people doing it. These are high-level professionals. And we feel really bad that we are using their services for little or nothing. The compensation they're receiving is almost nothing. And working with these people is extremely hard. Anyone who has worked with them will tell you, extremely difficult. So when people put their life, their time, their safety, everything on the line to work with these people, then others, out of, whatever reason, just come and start tarnishing our reputation. It's really, really bad. And last time when I watched one of the videos, I felt really bad. I had to practically call them and appeal to them. Look, let's do this. We know that these things can happen. But again, we need to appeal to Liberians. For people whose children are in treatment or were brought there somehow, I think we should encourage them to talk to their children so they can adhere to the rules of the facility, instead of just believing anything that doctors are saying. Thank you.
Okay, so we are already out of time. So, Dr. Sharif, let's hear from you, your party comment, shortly. Just call it a day.
Okay, thank you very much. We are very glad for this opportunity, and we hope to have more. All of us are in this together. We are not going to be discouraged by the side distractions. All of us, once we keep our focus, we are going to make it, and we are going to get these beneficiaries of this program rehabilitated.
Okay.
And we are going to see the evidence of it. That we can assure you. And the only thing we beg the public is to support us in the process. People in the communities should stop harboring these people. People are giving them places, and we should discourage that.
Exactly.
Thank you very much.
Well, thank you. Thank you, Injo, and the rest of the team, the FBS team. Thank you so much for hosting us. From time to time, we come here to provide updates. Today, it was more focused on the LRC facility, but hopefully next time, we can delve a little more into some of our interventions. Thank you.
Okay, so with that, this is how I would like to leave you on today's edition of Roadway to Health. Many thanks to our guests, Dr. Sharif and Dr. Zia, for providing that update for us this morning, that at least clear our doubts out there, the misinformation. I mean, it is very clear now. So we should reframe these talks that we have around here, while people are working tirelessly to make sure that the right thing is done, and people just, doing things that will just play with the efforts of other people. So with that, I would like to leave you on today's edition. My name is Angeline Noah. Until next Tuesday, have a good day.